For Willie Rennie.
A GP shortage threatening out-of-hours services from East Coast to West. Mental health waiting times skyrocketing. The worst cancer waiting times in 6 years. A&E waiting times missed months on end. And operations cancelled because surgical equipment isn't being sterilised for use. With a multi-million-pound shortfall in health board budgets, the BMA say the NHS in Scotland is getting worse, letting down patients and letting down staff. So while the First Minister has replaced her Health Secretary, can she also now tell us what new policies that Health Secretary will now pursue to clean up this mess?
First Minister.
Well, for weeks, of course, Willie Rennie's been standing up saying the Health Secretary has to change. Now that the Health Secretary has changed, he stands up. It's not the Health Secretary, it's the policies that have to change. Consistency has never been a particular strong point of Willie Rennie. But we will continue to invest record sums in the National Health Service. We will continue to employ record numbers of staff in the National Health Service. We will continue to make sure that we're rewarding them for the work that they do. And we will continue to take forward the reforms like the integration of health and social care, transferring more care into the community, shifting the balance of care that we know is so important to the future of our NHS. We're investing more in additional training places right across the spectrum of health service employees. So we will continue with that important work of investment and reform. And it's that work that is delivering and will continue to deliver for patients, which is why there is still such high patient satisfaction with our precious NHS in this country.
Willie Rennie.
The First Minister needs to know it's the policy and the leadership of the NHS that counts. I'm not hearing a commitment to change from the First Minister. That's perhaps why her own survey shows that people judge her performance on the NHS as getting worse. But if there is a crisis in the NHS, there is another in Scottish education. Nursery education rollout that's driving childminders and nurseries out of business. 5-year-olds being made to sit utterly pointless tests. A college sector hollowed out, and now the shambles of a cancelled education bill. Scottish education used to be the best in the world. Now it's just average. Letting down teachers, letting down pupils. Given that her own Growth Commission says the NHS and education would face years of added cuts, can she honestly say, can she honestly look Scotland in the eye and say that now is the time to hit the independence red button?
First Minister.
Well, I don't think Willie Rennie does himself any credit with that ridiculous hyperbole of a rambling, incoherent question. This is the government that has already increased childcare and is now working to double childcare for families and children right across the country. This is a government that's overseeing right now a narrowing of the attainment gap with record higher passes for our young people, more of our young people than ever before going into positive destinations after school. And of course we saw in an Audit Scotland report about colleges just last week that this government hasn't just met its target in terms of places at colleges, we've exceeded the target in terms of the number of young places at colleges. So despite and contrary to the ridiculous assertions of Willie Rennie, this is a government getting on with the job of improving education in early years, in school education, in colleges and in universities. And that's exactly what we're going to continue to do.
Some further supplementaries.